tonight, we will get back to you on it. But again, this is what it's about, that when you leave here this evening, you've had your questions answered and feeling reassured until our next one, when we meet again next month. So, and I suppose with regard to medication, it's something that affects all of us. It's something that we all have in common, no matter what our condition. And for me, it's the knowing why you're taking a medication, what you're taking, how we take it, when we take it, and the whole rigmarole around that. And that's something, once we have the education, it helps us to self-manage. So anybody that wants to ask a question during the presentation, for those on Zoom, just bring it through via the chat bar, and the team here will pass the questions on to the speaker at the end of the presentation. And those on Facebook Live, just under the video there, where you would put your message, and then you just send in your questions that way. So you can do that throughout the presentation. What we'll do is we'll run from one to the other, and then we'll do the question and answer session from then. Once that question and answer session is finished, then we come off Facebook Live, and with our Zoom participants, anybody who doesn't want to ask a question via chat but wants a conversation, we stay on here until about 9:30 to chat with you around any concerns or questions. Okay, so let's introduce Virginia. So Virginia Silvari is a senior pharmacist in CUH. You'd never guess I'm from Cork, would you? Because a lot of our speakers will come out of CUH, which is fantastic. And Virginia, like many others, as soon as I ask, will she come on, she does so. Virginia has spoke to our groups when we were able to meet face to face. So it's great to have her online here to share her expertise. And we appreciate it's her time and her expertise that she's sharing with us. So Virginia, is that okay? We'll pass over to you.
Perfect.
Thank you.
So, hi everybody. Before putting up my presentation, I will just want to say thank you for coming tonight. I wasn't expecting so many people. That's great. I'm delighted to see all these faces, and I will thank Lucinda and Katie for facilitating me tonight. And as Lucinda said, we will try to answer all your questions that you have on the medication, and I will just go on with the presentation. And I don't know, some of you might have seen me in cardiology wards in CUH, and if some other times come in, just say, oh, you know, I was at your class, so just to stop me, and it will be great to have a chat also inside the hospital. So I will go and share the screen. Let me see if it's this one. Perfect. Yeah, that's the right one. Just a sec. No, didn't take. So, sorry, took the wrong start. There you go. So, medicines for your heart. This is our talk for tonight. So, as you know, there are quite a lot of medications that are used in patients with cardiovascular disease. What is good is that although there are many classes of medications, there will be always one of the medication will be suitable for you. The doctor will assess you, and then in conjunction with yourself, will go through and pick the most appropriate for your condition, but also for your characteristics. But before going in deep on the medications that you take, I would like you to just to have in mind this quote that I think is very, very important to remember. So there was this American surgeon that once said, is Everett Koop, once said, medicines don't work if people don't take them. And it's so very true. So just have this mantra in your head and just say to yourself, okay, if I don't take my medication, that won't work on me. So why it's so important to take your medication? So we know that about 1/3 to half of the patients that are on long-term conditions, or medication for long-term condition, such as a patient with heart problem, cardiovascular disease, do not take their medication the way they are meant to take. So these cause that patients that are not adherent, they are not compliant with their medication, suffer then of experience quite serious consequences. And just to threat you a bit, what these consequences to be. It could be premature death, additional doctor visits, emergency department visits, and hospitalization. So we have to do our best. We have to commit ourselves in taking our medication and prevent that these dreadful consequences happen to us. So at the end of the day, it is your choice to take your medication. It is your choice to take it the way they've been prescribed to you. But just remember, if you take them correctly, they will help you with your heart condition. So I don't know, try to motivate yourself, set yourself goals, and let's say, oh, I have a graduation of my son, I really want to go there. It will be 1 year time. What I have to do, I have to feel good, have to be healthy, have to take my meds, I want to go there, or my daughter wedding, or things. So set goals in you that will motivate and will push you to follow all the directions with all the medication your doctor has prescribed. So an important trick is, we know that patients that know the most about their medications are more likely to take them. So try to go back to school and try to assign yourself one of your medication every day and study as much as you can. So learn the name of the medication, try to understand why they're being prescribed to you, how do they work, how do you take. Become familiar with the medication itself, with the box, with the color of the tablets. I know like sometimes you don't end up having the same brand of medication, but I always ask your pharmacist, oh, is this one just to replace that other brand? So get really familiar and make a list of medication and carry that medication, that list always with you. Because if something, let's say, if something happened outside your house on the street, and when the paramedics come, already just reading on the list of the meds, they might figure out what might be wrong with you. And so I don't know, put in your wallet, in your purse, but keep it in a safe place, always with you. So how do you take your medication? You take them always in the way the doctor has instructed, which means in the way it's written on the label on top of the boxes. Try not to miss a dose. I know it's nobody wants to miss a dose, but sometimes it happens. So what do you do if you miss a dose? You don't go and take an extra dose if you forget it, but each medication has inside of the box a patient information leaflet. And one of the questions that are answered in that patient information leaflet is, what do I do if I forget my medication? So it depends from the medication. So just go for the specific one, and there is a different, there could be a variation of between one medication to another. So what you can do if you find out, if you find hard to remember your medication, you could try the old system, alarms, alarm clock in the house, calendars, or like most of us now have a smartphone. I can see all of you now on Zoom calls. So you're becoming techier every day. So try to download an app on your smartphone. There are thousands about medication app, and those they will flag you, send you an alert. It's time for your diuretic, it's time for or ACE inhibitor. So just that could be a useful way for remembering your meds. So then some people sometimes experience side effects and said, oh no, I'm not going to take the medication anymore because it gives me this trouble. Just for you to know that if something happens, if you experience side effects, that's not the end of the world. You just go, you talk with your doctor, you talk with your pharmacist or nurse specialist, and just say, oh, you know, this medication gives me trouble. And there will be always a solution. It could be that the dose of that medication was too high and need to be reduced. It could be that it just has to be, you don't agree with that class of meds. So a medication from a different class will be chosen for you. So always speak up, always say if there is something that bothers you. When you go to see your cardiologist, it's good practice if you bring the bag with all your meds. So the cardiologist will know in real life what you're actually taking. And so I know sometimes like in a rush of an appointment, you might forget, but like try to remember and just bring your bag of meds. And if you want to buy a new over-the-counter medication, for example, or a new herbal remedies or recreational drugs, before doing that, talk to your pharmacist. So I would recommend to go always to the same pharmacy. They will have a record of your medication, the usual medication, and they will tell you, okay, this new over-the-counter preparation that you want to buy, medication you want to buy, it's okay with the rest of your medication, or it's not okay for the rest of your medication. So try to go to the same pharmacy every time.
Oh yeah, I have it on the meat. I have them up now, sure.
Will I keep going? Hi.
Hi, Joey. Will you just put your mic on mute there? Thanks, Emil. Thanks, Virginia.
So before taking a medication, a new medication, I would like you to ask these 5 questions to your doctor. I found in one of them, I think it was the American Heart Foundation that I was giving this trick, and I think it would be very, very good for you to learn these key questions. So can I take this new medication with my other medication? Should I avoid certain food, beverage, or other products? What are the side effects that I should know about this medication? And how will it work in my body? And where can I find more information on the medication? I highly recommend you to get informed of what you take. The more you know, the more likely you are that you take your meds. So use the patient information leaflets. They are very good. They are patient oriented. They answer many questions, and it gives you also like the power and empower you to know I'm taking these because I have that, and it will help me with this. So here you can see there are different classes of medication used for heart disease. So they are not only for heart failure patients, but I suppose
that's all.
I suppose some of you unfortunately will have more than one condition. So let's say we have classes such anticoagulant, antiplatelets, ACE inhibitors, or angiotensin receptor blockers, or ARNI, the angiotensin receptor neprilysis inhibitor, diuretics, mineral corticoid receptor antagonists, antiarrhythmics, beta blockers, calcium channel blockers, cholesterol lowering medication, digital preparation, SGLT2 inhibitors, and vasodilators. So I would say, like, for heart failure patients, what the latest guidelines recommend would be an ARNI, which would be in this class, and an ARNI, a mineral corticoid antagonist, a beta blocker, and SGLT2 inhibitors. But I'm gonna go now through the different classes of medication use in heart diseases, and just speak a bit about most of them. So first of all, I'm going to talk about ACE inhibitor, angiotensin II receptor blockers, and the angiotensin receptor neprilysin inhibitor, or ARNI. So let's say up to now, let's say up to 2 or 3 years ago, ACE inhibitors and angiotensin II receptor angiotensin II receptor blockers were used quite a lot in heart disease patients, including in heart failure patients. What they do, they decrease the substances that could raise your blood pressure, and at the same time make it easier for your heart to pump blood around your body. The way I consider this medication is like they are kind of booster to make your heart so efficient and so strong, and you feel very well, and very useful also in the heart failure patient. And then recently a new class is called the ARNI class, with at the moment only this combination is called sacubitril valsartan, and the brand name is Entresto, has been introduced and has been seen how is very effective in patients with long-term heart failure in adults. These medications, such like all the medication, might cause side effects to who takes them. And let's say if we talk to the ACE inhibitor, an example would be ramipril. People might experience a tickly dry cough. It's funny, when I do the cardio rehab in CUH, the second that I say, oh, you know, this one could give you dry cough, after 2 seconds, the 20 people start doing even if they're not on that. So if that happens and you have this dry cough, don't worry, just say to your cardiologist, and they might switch you then in what is called the ARB, or they might switch you in the Entresto, in the ARNI class. What is important with this medication is like, just to have in mind, you have to have a regular blood test because your potassium might rise. So usually they start in a low dose, and then gradually the dose is increased, depending if you tolerate, up to the max dose that you tolerate. Then what do I mean with tolerate? Some people, like, the higher the dose it is, the more effective will be on the blood pressure, for example, and let's say their blood pressure might go too low. So that is a way for the doctor to know, okay, I have to stop here. So you probably will see your medication changed every 2 weeks. 2 to 4 weeks. That gives time to your body to adjust and see how it responds to the medication. Beta blockers. So the beta blockers slow your heart rate and lower your blood pressure, and that allow a reduction in the heart workload. Some people might use also to prevent episodes of chest pain, and it helps to improve the amount of exercise that you're able to do. Again, the beta blockers, we have a different, probably the most common used would be the bisoprolol, the nebivolol. Patient with a heart failure, they might be on carvedilol, which is the only one that it's taken twice a day. Side effects of beta blocker could be a bit like, could give you fatigue, dizziness. Again, this could be due maybe to a dose too high. So always say, oh look, since I'm taking the beta blocker at such dose, I feel more fatigued. So just say, and something will be done. Some people might experience cold hands or cold feet. For the man, erectile dysfunction, and the blood sugars might rise. So again, it's important to have your blood test regularly done. Diuretics. So I suppose patients with heart failure are used to take diuretics. What diuretics are, they're used to remove extra water in your body to reduce the extra strain of the heart. So side effects, again, it could be feeling dizzy, tired. Some people might experience cramps due to dehydration. So it's very important. I know that a patient with heart failure is so well knowledgeable about their diuretics. They know their drive weight. They know how to increase and decrease the dose, and it is important, though, in any case, to report if you experience any side effect. So you probably are used to the furosemide, the bumetanide. This would be probably the one that you are prescribed. Like I'm mentioning there, the spironolactone and the eplerenone, they are the mineral corticoid antagonist, and just for the men, they might with the spironolactone, they might experience pain in the breast. If that happens, just inform your cardiologist, and a switch will be done. This one is more for patient. I don't know if any of you has experienced an heart attack, but usually patients with had an heart attack or a stroke, they are on an antiplatelet. The most common, the most known antiplatelet, I would say, is aspirin. So aspirin at 75 milligram once daily, it's what usually a patient is prescribed after heart attack. And besides the aspirin, there would be a second antiplatelet, which patient that have received a stent or gone for a bypass will be put on. So the second antiplatelet, they are kind of like more potent antiplatelets, and their name are ticagrelor, clopidogrel, and prasugrel. All these medication prevent the formation of clots, so prevent you to have to experience an heart attack or a future stroke. Side effects, we know that could be bleeding. That's the major side effect. So be very careful, especially like if you're around the kitchen, or if you shave yourself, maybe switching to an electric shaver. That might help. With, like, if you cut your face with the bleeding. Cholesterol-lowering medications, again, highly recommend in patients that had heart attack. And in this class, the most known, in this group of medicine, most known is the class of the statins. So things called atorvastatin, rosuvastatin, and pravastatin, they would be the medication used. The good thing with these statins is that they prevent the formation of fatty deposits, which are called plaques. And if these plaques break, these little pieces of plaques could go and block a coronary artery. So there won't be blood of oxygen that is able to reach your heart, and that part of the heart will get damaged. Statins reduce the risk of a heart attack in high-risk patients, even if the cholesterol levels are normal. Side effects for medications such as statin, it could be muscle pain, joint pain, and back pain. It is important that you get your liver function checked often because they might become abnormal. Calcium channel blockers. So these are mainly used for reducing your blood pressure. So you might be on something called loadipine, lercanidipine, and they work by relaxing the blood vessels. And some of them, they might also be involved with the heart rate. So the calcium channel blocker cause vasodilation, and so in your veins, which means more blood will be able to reach and bring oxygen to your heart. But you have to keep an eye on your ankles. There might be swelling of the ankle. You might experience facial flushing, and some people dizziness if the blood pressure drops too much. So again, if that happens, just say. Anticoagulants. So these are blood thinners. They are quite strong compared to the antiplatelets. So who is on a blood thinner? It could be a patient with kind of a funny heart rhythm, an irregular heartbeat. And we know the patient with heart failure might have also atrial fibrillation. As well, there could be patients that had a valve replaced. So they are now with a prosthetic valve. There might be an anticoagulant. So the old anticoagulant that has been around for ages is the warfarin, and we know that if you're on warfarin, you will be attending loads of education classes because there could be interactions with your medication, there could be interaction with your food. And you will have to have regular INR checks, like blood monitoring. There are now on the market anticoagulants. They are less troublesome than warfarin. So these are called direct oral anticoagulants or newer oral anticoagulants. And these drugs are, especially for patients that have atrial fibrillation, extremely helpful in preventing a stroke in the patient that take them. Patients that have a prosthetic valve, which is a mechanical valve, for them the only option is still warfarin. So with an anticoagulant, what is important to watch is definitely if there is any sign of bleeding. So always check your urines, your stools, and if you see any blood, inform straight away your GP. Just remember, be very careful with like if you are in the kitchen cutting things or working with the car. If you cut yourself, it will take quite a long time before stopping. When we talk about the direct oral anticoagulants, so the DOACs, just remember that they work very well, but if you don't take them, you won't be protected. So it's very, very important that you are compliant. And I believe many of you that are attending tonight are probably in one of these medications, such as apixaban, rivaroxaban, edoxaban, or dabigatran. Antiarrhythmics, again, as I said, patients with heart failure might have atrial fibrillation as well, and might be on this medication, antiarrhythmic medication, which are used to control the rhythm of the heart. Side effects. So one of the antiarrhythmic widely used is amiodarone. Very effective medication, but there are quite few things to be to be careful. And one of these, it would be if you take amiodarone and you go out the sun, you might burn yourself. So always there a total block, and always try to go out with long sleeves and hat. And then there should be also a regular blood test in terms of liver functions and thyroid function. Vasodilators, this is pretty much for patients that have kind of chest pain. So what they do, they relax your veins, and that means that more blood and oxygen can reach your heart. So let's say some patient might be on what is called the GTN spray, glyceryl trinitrate. This is a spray that if you have chest pain, you will spray under the tongue, and almost like within 5 minutes, you shouldn't feel the chest pain anymore. If the chest pain is still there, you spray again, you wait 5 minutes, and it's still there, you ring the ambulance and said, "Oh, I think I'm experiencing an heart attack, and please come and get me and bring me to the hospital." Side effects, low blood pressure, flushing. Just remember, don't take medication such as Viagra while you are on trinitrate. Your blood pressure might drop, and don't drink alcohol for at least 30 minutes after using your GTN spray. So take-home messages for tonight. So do not stop taking your medication if you feel well. Just remember, you're feeling well because you're taking your medication. So keep going the good work. And tell your doctor all your medications that you take, and ask always if you want to buy over-the-counter medication, herbal remedies, vitamins, or supplements. Your doctor needs to know everything that you take and everything that you want to start taking. For heart medication, there's no problem with generic medication to work as well as the brand name. This is very true for heart medications that you're on, but if you are on other medication like antiepileptics or things like that, that would be a different situation. So for the heart meds, brand names or generics are okay, are the same. And then the very last, the medication keep you healthy, but it's not the only thing. You have to have a good lifestyle as well. So balance the diet and have regular exercise, physical exercise. So what I always conclude my talk at Cardiac Rehab is, it's not that you take, let's say, the cholesterol tablets and then you have a fry before going to bed. So just everything in moderation, and continue with your meds, have a great diet, good diet, and do physical activity. So these are some of the websites that I like to go to get inspiration, I think, are exceptional. The Irish Heart Foundation, but also the American, the British, the Australian. So this presentation is taken from this website. They have, I think, an incredible way of talking to the patient the right way. And you can download the booklet and everything from the Heart Foundation. So thank you very much, everybody, for listening to me, and looking forward to your questions. Thanks.
Thanks, Virginia. And as we thought, there's lots of questions. So no, it's good. It's really good. So what we will do, and thank you, because it's such a super education piece, Virginia, and your tips that you always give, and you've so much to cover, but so well. So thank you. And you'll see from the questions how patients are interacting with what you've said. So